For what purpose does the gentlewoman from California, who's a member of the committee, rise?
Okay, Madam Chair, I move to strike the last word.
Gentlewoman is recognized for 5 minutes.
I rise in opposition to the Pence amendment and the war on women throughout this bill. And to the gentleman from Indiana, just take a look at what's being proposed and why I call it a war on women. First, the elimination of funding for life-saving family planning programs funded by Title X, which help provide a range of critical services, including testing for sexually transmitted infections, contraceptives, and annual health exams, and which, by the way, do not include abortion services, though I wish that law were overturned. This war on women totally eliminates the President's Teen Pregnancy Prevention Initiative, which supports evidence-based sex education and are specifically designed to reduce abortions. It imposes a funding restriction on how the District of Columbia can use its own funds to pay for health care and abortion services. It includes an amendment to restrict state Medicaid funding for family planning, which are predominantly women of color in many communities. This is really a shame and disgrace. This includes an amendment to reinstate the federal refusal rule issued in the waning days of the Bush administration, which would dramatically expand the current ability of health providers to refuse to provide health care services that they oppose ideologically, which jeopardize the ability of patients to get health care. And that's just on the domestic front. The bill funding for the United Nations Population Fund, which provides critical reproductive health care, including family planning services to the world's poorest women, and which does not provide abortion services, though they are much needed. This bill also reinstates the global gag rule and prevents family planning organizations that provide abortions with their own private money from receiving federal funds. This bill cuts $100 million from USAID's family planning program, but that's not enough for some people, as an amendment was filed to completely eliminate these programs, which help prevent more than 7.8 million unintended pregnancies around the world. These decisions by the Republican majority will endanger women's health, severely restrict women's rights, insert the government into the private medical decisions of women and their families, and are nothing short but an all-out war against women, and we are fighting back. Instead of working together to get our economy moving again, to help the unemployed and to create jobs, Republicans are seeking to impose an ideological agenda on the country. And now we have the Pence amendment, an amendment that would restrict Title X funding from going to Planned Parenthood, one of the oldest, most important, most trusted, most utilized public health organization in the country. Let's be clear, this is not about abortion. Existing restrictions prevent federal funding for abortion. This is about a direct attack on an organization that provides critical health services aimed largely at women in underserved communities throughout the country. With over 85 local affiliates and more than 800 health centers across the country, the services provided by Planned Parenthood are invaluable. Every year, Planned Parenthood affiliates see nearly 3 million patients and provide contraception to nearly 2.5 million patients and over 1.1 million pregnancy tests. They identify nearly 1 million, provide nearly 1 million Pap tests, identifying about 93,000 women at risk of cervical cancer. They provide 830,000 breast exams, nearly 4 million tests for sexually transmitted infections, including HIV. They provide health education for nearly 1.2 million people. How are any of these activities objectionable? Are you against women getting breast exams? Do you object to women and girls getting tested for HIV? Are you opposed to women controlling their own bodies and determining if and when they want to get pregnant? Let's be clear, government funding does not make up the whole sum of family planning and Planned Parenthood's finances, but government funding does provide invaluable source to help local health centers provide services for women to avoid cancer, to protect their health, and to lead healthy and fulfilling lives. So let's stop this attack on a trusted health provider, and let's stop this war on women. That's not what the American people want. They want jobs. They want a chance to work hard and take care of their families. They don't want to argue with their insurance provider or with their employer or their government or their elected officials about abortions. We should be working together to unite our country and to tackle the challenges that Americans face each and every day, and not pursuing divisive, ideologically driven agenda. So I urge a no vote on this CR and on all these amendments that wage war on women.
What purpose is the gentleman